Toukhy, who is a professor of ophthalmology at Cairo University and the director of the National Eye Center and the head of oculoplastic and lacrimal department, who's going to be talking about platelet-rich plasminogen in dry eye disease.
Thank you, Kyle, and thank you for Fairouz, Kasturi, Santosh, and the whole scientific committee and the organizers. It's always a pleasure being in India. I will talk about dry eyes and the PRP injection that we have been using frequently, actually, in the last couple of years or even more. We all know what is platelet-rich plasma. It's the most commonly used biostimulator, and we know how is it prepared. It contains a lot of growth factors and other factors that promote healing and epithelialization and activation, actually, of cells and tissue growth, collagen synthesis. There is very few studies about the PRP, and there is a lot of questions, yet it is widely used by dermatologists, for example. Every dermatologist injects PRP in joints, hair. We usually, as an oculoplastic surgeon, many times we inject and use PRP for scars, for following burns, for lash growths after some injuries, for the brow hair to grow after injuries. We've been trying and using this a lot, although we understand that there is no scientific data that really supports this, but we know that it helps. At least it will do no harm, which is the basics that we all learn about medicine. Even in dry eyes, PRP has been used, and serum has been used as an eye drop for the ocular surface to promote healing of the corneal epithelium. So what we did is that we injected PRP directly in the lacrimal gland in patients who has evidence of aqueous deficient dry eyes. Definitely not meibomian gland dysfunction, but with aqueous deficiency, with tests, whether tear osmolarity, Schirmer, breakup time, tear meniscus height, when tests clearly shows that they have a reduction in the lacrimal gland secretion, we started using PRP injections in the lacrimal gland. We usually use 3 to 4 injections, 1 month apart. We had good results. We moved a step forward and we started to do it as a study, and then we needed control, so we actually worked on several groups. One group, we did the injection on one side, and we gave PRP eye drops on the other side, which is I'm going to present right now. But we have also another group that was working on, for studies and for publishing, we have to be as low biased as possible. So the next group that we're working on is we're injecting PRP on one side, and we're injecting normal saline on the other side as a control group. And because we also depend on the patient's response, we need the patient to tell us, did he improve or not? And definitely, if we inject on one side and give a drop on the other side, most probably he will say he improved on the side that got the injection. So we had to give injections on both sides in the second group. This group is the group that we inject on one side and gave PRP as an eye drop on the other side. 50 patients, 44 of them were injected transconjunctivally, 6 of them were injected transcutaneously, and we followed them up using the Schirmer, the breakup time, and the tear meniscus height, as well as the OSDI, although we think that the patient will always favor and get biased to the side of the injection, so we did the other group as I explained. We had few complications. Mostly of them were related to hemorrhage, and these are the complications: subconjunctival hemorrhage, real orbital hemorrhage with subconjunctival, and another one of lid edema, but none of them were visually significant and had no long-term sequelae. the good thing is that the symptoms, the Schirmer test, the breakup time, and the tear meniscus height all improved on the side that got the plasma-rich platelet injection. Okay. This is a simple, safe in our hands at least. We think it's very effective in aqueous deficient dry eyes. It can be added to the armamentarium that is being used. We're not scientifically, we don't have histological evidence of improvement of the lacrimal gland function, but we have both symptoms and we have clinical signs, evidence of improved tear film and symptoms of dry eyes. We're still working, it's in the beginning, but we think it is promising. Thank you.